Hello, I'm Dr. Jimmy Douglas, and in this video, we'll see what is insulin resistance and how it affects your health. Whenever there is increase in blood glucose levels, insulin is secreted and it gets the blood glucose level down by making the cells of the liver, muscle and fat to take up glucose to be used as energy. If there is insulin release in response to high glucose and the cells of the body do not respond to insulin and the uptake of glucose is either impaired or reduced, then there is resistance for glucose to enter into the cells. This is called as insulin resistance or insulin insensitivity. That is, the cells are insensitive to insulin release. Causes of insulin resistance. Even though the exact cause is uncertain,
genetic and lifestyle factors are attributed to insulin resistance.
This insulin resistance may be temporary or chronic. It may be due to intake of certain medications. Another common cause is sedentary lifestyle. If you don't get enough exercise, your body can become resistant to insulin. One of the most common causes is being overweight or obese. Having too much fat around your organs makes it more difficult for your body to use insulin properly. Visceral obesity due to accumulation of fat in the stomach area correlates with insulin resistance. Subcutaneous abdominal fat seem to have less of an association with insulin resistance. There are many patients with type 2 diabetes who are not very obese but have increased visceral fat. They are termed as metabolically obese. How do you know if you are at risk? By measuring your waist circumference with a measuring tape. Males are at risk if their waist measurement is more than 40 inches, and females are at risk if their waist measurement is more than 35 inches. These measurements don't apply to children or pregnant women. Always remember, the correct way to measure your waist circumference is at the level of umbilicus or belly button, as shown in this figure. Visceral fat is more dangerous. It's important to exercise, as exercise may affect the deposition of visceral fat. And this visceral fat leads to insulin resistance, and again will lead to heart disease, non-alcoholic fatty liver disease, metabolic syndrome, polycystic ovarian syndrome. Does insulin resistance lead to diabetes? This insulin resistance will lead to pre-diabetes. The pancreas will go on producing more and more insulin to overcome the resistance so that the blood glucose levels are within normal limits or slightly above the normal limits. And when this goes on for longer duration or many years, then there will be depletion of beta cells leading to lack of insulin. And when this is combined with insulin resistance, will lead to type 2 diabetes. How is insulin resistance harmful? High insulin levels will lead to higher triglyceride levels, non-alcoholic fatty liver disease, polycystic ovarian syndrome, fatigue, weight gain around the waist, hardening of the arteries, headache, high blood pressure, irritability, lack of motivation. It is also linked to metabolic syndrome, which leads to increased risk of heart disease and stroke. How to reverse insulin resistance? It can be done by making the cells more effective in taking up glucose and being sensitive to insulin release, thereby requiring less insulin. Being physically active makes you more sensitive to insulin, and it's important to avoid refined carbohydrates, sugary drinks like colas, processed meat which increase the sugar levels fast, and to opt for complex carbohydrate. Effective management of stress, losing weight and to get enough sleep will help you reverse insulin resistance. Your doctor's goal is not only to control your high blood glucose levels but also to manage high blood pressure and deranged lipid profile, which may lead to heart attack and stroke. Thank you for watching, and see you in the next video.